All right, there it is. Okay. Hi, everyone. Good afternoon, and welcome to the March 6th session of the Virtual Learning Collaborative, Understanding State Immunizations Programs and Section 317 Immunization Programs to Increase Access to Adult Hepatitis Vaccination Services, made possible in partnership with the CDC Division of Viral Hepatitis. So my name is Zakia Grubbs, manager here on the hepatitis team at NASDAQ, and we have our two presenters today, Heather Bush from the Utah Department of Health and also HepTAC consultant, and Ami Gandhi from the Georgia Department of Health and also HepTAC consultant. The format for today's session is as follows. We will start with presentations by Heather and Ami, and we will be following that with a discussion. So feel free to use the chat to introduce yourself, which jurisdiction you're coming from, and if you all have questions during the presentations. So with that, I will turn it over to Heather to get us started. So let me stop sharing. Oh, you're on mute, Heather. It's okay.
I almost had it. Welcome, everybody. I'm Heather Bush. I'm a HepTAC consultant with NASDAQ, and I'm also the HIV prevention manager at the Utah Department of Health and Human Services. I was previously the viral hepatitis prevention coordinator and also our syringe exchange coordinator. So I've kind of made the rounds, but these three things, HIV, viral hepatitis, and harm reduction, are my three passions, and of course they all go together. So today I'm going to be talking to you kind of with some of those different hats on. I'm going to talk to you first as a HepTAC consultant, and then I'll talk to you second as the HIV prevention manager here. So what basically spawned both this VLC and a lot of the work that I've been doing for the past 6 months or so is we all know that hepatitis B vaccination is really crucial if we're looking at elimination of viral hepatitis, and of course in preventing outbreaks and safeguarding public health in general. We know that adult Hep B vaccination is really important within harm reduction programs, it's part of that syndemic, right? So we know that when people are at risk for HIV, hepatitis C, when they're using drugs, when they're maybe experiencing homelessness, they're an immigrant, they have various different issues that being able to get that vaccine, especially for adults who either maybe missed out on getting it as a child or maybe are coming from a country where they didn't have the access to hepatitis B vaccine. So one of our real strategies is looking at, okay, that's great. We all understand the purpose for it. It's now recommended for all adults. But now, how do we actually get it out into our programs? So we need to identify strategies to make this more accessible for our populations and to look at how to, oh boy, sorry. Oh, I hate it when I do that. And then to identify the strategies to ensure equitable access to adult hepatitis B vaccines, especially for our underserved populations that we mentioned, that are most of what most of us work with. We also many times have challenges with geographical disparities. So maybe some high population cities that maybe have more resources or may be able to get more adult hepatitis B vaccines than others. And so trying to get it out into some of those rural areas or into some of the areas that maybe are underserved with this population. And then, of course, we all face the largest challenge of, okay, great, we all get it, but how do we have funding? Who do we work with? What do we do to make this happen? So this has been really a big goal that we've been working on. And one of those is looking at what are some programs around the country that maybe can give us some clues, help us not reinvent the real wheel, which is really what HepTAC is all about, is using the expertise of people in the country who are already doing some of these things and maybe have some successes to talk about. So I'm going to talk a little bit about a resource that we've been working on, some of the things that we've been trying to gather to support you all. And then you'll hear briefly from me about a program that we initiated here in Utah. And then we'll hear from Amy about a wonderful program in Georgia. So there are lots of payment options for adult vaccines. Of course, the first one being insurance. We know that insurance is super helpful in that way. Are you guys, did I lose the slideshow? Okay, sorry. So, many private insurances will vaccinate somebody for free. Also Medicaid, Medicare. But as we also know, a lot of people either aren't on those or don't have access to those types of support. So one of the things though we can do is, of course, help people either get signed up for insurance, get signed up for Medicaid if they aren't, and then when they have that coverage, help them access and help them find ways to get that hepatitis B vaccine. Another option is to utilize vaccine assistance programs, which we'll talk about a little bit more in a minute. So I'm just gonna kind of skip over that for now. Working with our federally qualified health centers, many of them do have funding to support adult vaccinations. They may also need to bill an insurance or Medicaid. So working with them, identifying those in your communities, maybe setting up some sort of a immunization clinic, or just knowing where maybe some good referral points you have and what services they offer, what are their qualifications. So we always really encourage working with your FQHCs to identify those options. Also, many workplaces will have vaccination programs. So some of them may mandate hepatitis B vaccine. That's when I first, because I, as an adult, missed out on, I was not at the age where I was given a vaccine as a child. So when I first worked for a substance use treatment program back in the 90s, they required that I get the hepatitis B vaccine and they paid for it. So that was a really nice option. And many places may have that in their workplace, especially if they're working in something that, maybe construction or different types of things where they may have some risks for bloodborne pathogens. Their workplace may pay for it, and they, again, may not be aware of it. So it could be maybe contacting, if you have a larger company in your area, working with them to identify if they have a vaccination program, working to see if you can help them encourage people to take advantage of that. Also, many workplaces may not even really recognize that and recognize that they could do a, like a yearly mass vaccination. That sounds kind of scary, but a group vaccination has that for people who need it, who are their employees and perhaps even their families. There are also some publicly funded vaccination clinics. Some of the states that I've been able to talk to recently have just very specific vaccination clinics that are publicly funded that offer vaccines for adults as well as children. So finding out what those are available in your area and learning how to work with them. Also, some public-private partnerships, perhaps reaching out to pharma, identifying some partnerships that may be able to help you there to fund hepatitis B vaccines. There's a lot out there. It's, again, a lot of these are just doing some research and making some phone calls. And then, of course, we're always looking at, well, how do we fund it? How do we make sure that people are able to get these vaccines? But some of it can just be doing the outreach and education, as we talked about. Lots of times people may have opportunities with their own insurance, with their workplace, within their communities, and they just don't even know it, or they just don't even really realize that getting a Hep B vaccine as an adult is important. So just doing some outreach education, that can go a really, really long way. But then if you've done your research and have some backups and know where to send people and some resources to send them, you can. I will also be sharing some resources at the end of this presentation, and we will send them out after this presentation on some really great national and even some local resources. So this one's a little wordy, but I just wanted to kind of make sure that we were able to cover it. So back to vaccine assistance programs. Many of you may be familiar with these, and many of you may already utilize them. And again, we'd love to hear from you and love to hear how your states and your programs are using some of these techniques that I mentioned on the last slide, as well as this one. So the Vaccines for Adults program is operated by the CDC, and this provides resources and recommendations and strategies to improve vaccination rates and offers guidance on vaccines, bills, and codings, and patient education. So there is a lot here. This may or may not have any direct funding to actually pay for vaccines themselves, but most states do have access to this program. I also recognize that many states have different organizations. So you may work very closely with your immunization program. You may be your immunization program. You may work, I just found out we are going back to the office next month, 2 days a week, and we're sharing a cubicle. And I just found out a couple of weeks ago that I will be sharing with my counterpart in the immunization program that I've been working with on Hep B vaccines. So it's kind of cool. So we're going to be cube buddies. So sometimes that's you work very closely with them. Sometimes you may not even know who they are. They may be in a different department. They may be in a different division. They may operate very separately from you. So one of my suggestions is, if you are purely in prevention programming and you don't know, seek out your immunization program, find out who your Hep A and B people are, talk to them. Even if, like with our program, we specifically have children Hep B program, but find out what they do, involve them in your programming, get them involved. So there may be a lot more chances to overlap than you realize. And they have access to a lot of these programs through their funding that they may not know what to do with. So I'll talk to you about that a little bit in a minute. So we do have the Vaccines for Children program. And even though that obviously covers mostly pediatric vaccines, it also covers some vaccines for eligible adults. The Section 317 immunization program, this is very specific for funding vaccine for purchase distribution. This was previously really focused on the childhood immunizations, but now it can really be expanded to be used for adult vaccine initiatives. So again, if you're not already, work with your state immunization program to identify what 317 funding, and I know Amy's going to talk a lot about this, what 317 funding they have, what's utilized, how are they allocating it, what are their objectives, and how maybe you can partner on sharing some of that load with them. And also to see if perhaps when they apply next time, if they maybe in the past have not really considered adult vaccines as part of the application and haven't really applied for that or haven't known what to do with that, you may be able to identify some options to help them expand that funding and then help them implement that. And then lastly, we have pharmaceutical assistance programs. As we know that there's many patient assistance programs that provide vaccines, including Hep B at reduced or no cost to eligible individuals. So as we talked about earlier, the private-public partnerships, you may be able to partner directly with the manufacturer to facilitate some of that access. It could be maybe getting some immunization coupons, help them apply for that patient assistance, look into what those options are. So again, a little bit of research and kind of setting up some of these things so that when you do your education outreach, you can then make referrals to people to these programs. So again, this is just talking about 317 more specifically, basically reiterating what I already said, but it does target uninsured or underinsured adults and high-risk populations, which are what most of us are working with. And really the goal is to improve overall immunization rates. As we know, you know, we all are very familiar with how immunization works and how public health works, but really looking at it from a standpoint of how it improves the community as a whole. The more people who are at high risk who can get immunized is very important. So as we talked about, just kind of, you know, partnering with FQHCs, establishing workplace vaccination programs, forming public-private partnerships, engaging outreach and education, also looking at telehealth and mobile clinics. What are maybe some telehealth and mobile clinics that are working right now? Are they offering Hep B vaccines or access to Hep B vaccines? Can you partner with them? And then looking at that data collection and analysis, it's very important. One thing that maybe you can do, even if you're not able to access any direct funding or resources, but collecting the data and an analysis to be able to make the case for this gap and what is needed and what are specifically some of the barriers so that you can help target it. Again, you guys know all this, but just really focusing in on who in your community does not have their Hep B vaccines, who needs it, what are those populations, what are some of the specific barriers to those populations, and then where can you help fill in some of those holes with some of those strategies that we've already discussed. So just kind of in conclusion is we really encourage all health departments, if you're not already, to look at some of the strategies we've discussed and looked at how maybe you can work with existing and other programs in your community and maybe even in your health department to look how to implement, monitor, and refine these approaches for better health outcomes. So in other words, how can we work together to increase the rates of hepatitis B vaccine rates among adults? So all of this that I've just discussed is I've been putting together a resource, and that resource outlines all these ideas with a lot more detail and with more links to some great resources. So we will be sharing that soon, but we've also been trying to make that resource a little more robust with some examples and some more specifics from different states, what they have done very specifically. So again, I'm going to give you one example here from Utah, and then I'll pass it over to Amy to talk about what she's done in Georgia. So, and if you have anything that you want to share, please just email hepatitis@nasdad.org, right? Zakia, would that be the best? Just the hepatitis email? Okay. So anybody go ahead, and if you have that, and I have not been looking at the chat. Is there anything? Oh, thank you, Zakia. Thank you. Yeah, I'm looking at some of the comments. These are great suggestions. Since I don't have the capacity to follow people for the second or third. Oh, that's a great question. And that may be a really great, I was just reading the question. So our mobile vax team works with us on a health fair sometimes, but doesn't include hepatitis A or hepatitis B vaccines since they don't have the capacity to follow up on people for the second or third dose. Do you have any advice on how to address this? I think that's a great idea. It could be a suggestion of, hey, if I pull together and we have our let's say I bring to you a bunch of our syringe service programs, and or you come, we arrange kind of an organized for these people, and then you and the syringe service programs, or you and the harm reduction programs, then you arrange to make the arrangements to get that second and third. So maybe you schedule, the mobile outreach on these specific days, and then you help them out and you say, if you'll provide us with the vaccines, we will make sure that we get people back for those second and third options. Or working with perhaps people who are experiencing homelessness, if they have a resource fair, is finding ways, and you use the resources of people who are already working with those populations or already track them down. I love the discussion here about utilizing 317 and how to do that. So that's great. I love this discussion. And then also somebody mentioned that even a single hepatitis A vaccine is better than nothing. So, and it's very effective. So at least getting one hepatitis A is really valuable. And I know that we've done that in our state, and I know several others as well. We had a hepatitis A outbreak, and it was particularly among people who inject drugs and people experiencing homelessness. So our local health department went out and did outreach with our syringe service programs because they had the trust in the rapport, and they could say, hey, here's our local health department. They're coming. They're going to give you these vaccines. And they were able to make those connections between those partners that was really valuable, that the health department so they had the vaccine, they had the people, they had everything, but they just didn't have the access. So perhaps you could be that link and provide that access. Thank you again for all the discussion in the chat. Zaki, I assume we're capturing all of that as well as this session is recorded. So thank you very much. All right. So there are lots of other states that have programs. I've been trying to connect with some of these states and haven't had luck. So if you guys have a program, and it could even be a very small example, because the example I'm going to give is a very small example of what we've done here in Utah. Any ideas or suggestions that you have on just improving the access to both hepatitis A? I mean, we've been mostly talking about Hep B vaccine, but definitely A and B, and how you've leveraged various funding or different types of partnerships to increase even by just a little bit. So our program here that I'll talk about in Utah, a little really exciting kind of example of how you can bring these people together, just kind of a partnership was able to help. So we have a free PrEP clinic at the University of Utah. This PrEP clinic offers testing and treatment for STIs, including HIV, of course. provides PrEP case manager navigation, medical management, lab services, medications for people who have a higher chance of contracting HIV, so the medication for PrEP, HIV risk reduction education, and they provide them all free. They only accept people who do not have health insurance. If they do have health insurance or Medicaid, or they need help getting on there, they can then transition them to their other clinics. But this one is specifically for people who do not have health insurance. Some of the big challenges they have is, of course, with many of these free things, is the university donates the space and some of the equipment, and the doctors donate their time. But they have very short windows. They're only able to serve so many clients, but they've still been able to serve quite a bit. And so the HIV prevention program, my program, actually pays for their coordinator, their intake coordinator, and many of the labs. So it's a great partnership with the University of Utah and the Department of Health and Human Services HIV prevention program with the funding from the CDC. So they came to us one day, the PrEP clinic came to us one day and said, hey, we recognize that the new PrEP guidelines and the Hep B vaccination guidelines are really indicating that we should be testing all people, well, testing and vaccinating all people who are using PrEP for hepatitis B. And, you know, all these populations here are many times the populations who are seeking PrEP. So therefore, they came to us at the HIV prevention program and said, hey, do you have any other money for us that you can give us to provide A and B vaccinations for our PrEP clients? And we said, no, we don't have any more money. We're giving you all the money we have. As many of you know, there's a cap on how much money we can give them for clinical services. So there's not much we could do, but because I did have a relationship with our immunization program, I went and talked to them and said, do you guys have any ideas on things that you could do? So they let me know of their adult high risk initiative. And they said it was formerly known as the Adult Hep B Initiative. This one is that all 19 or older year-olds who do not have insurance or uninsured should be screened for hepatitis B and administered full hepatitis B vaccination series. I apologize, my little typo here. So in other words, they had this initiative, they had this funding set aside to reach people, high-risk adults who are uninsured with hepatitis B vaccines. So we're like, well, this is the perfect pairing then. This is we have this free health clinic who only serves people who are underinsured. They are all adults, and many of them need a hepatitis B vaccine. Our immunization program had this funding and this objective to provide adult hepatitis B vaccines to underserved, uninsured adults. And so we were able to connect them. So they were able to both meet their objectives. So like I said, that's just a very small example. That's not funding a huge thing, but it's just a very small example of how we can maybe many times just be that conduit, be able to make some of those connections and help those two programs. So they just started, the PrEP clinic has just started doing this, so I don't really have any data on how that's been going, but I will hopefully in the next few months be able to share a little bit more about that. So that is just one example. And just to wrap up my presentation, these are some of the resources that we have that we'll be sharing with you, where I got a lot of my information from, and then some really good ideas on how to further expand the options for adult immunizations, you know, for Hep A and B. Some really good ideas from throughout the national resources. But like I said, we're really looking for, and I can see that there's a bunch of resources in the chat. what are some peer-to-peer ideas that we have? And that is the end of my presentation. Are there any questions for me, or do we want to save that for the discussion at the end?
Yeah, we can transfer to Amy's presentation and then discussion
Great.
at the end. So thank you so much,
Perfect.
Natalie.
Thank you.
You're on mute.
Sorry, should learn by now that we're on mute all the time. So thanks for inviting me to present on the VLC for today. My name is Ami Gandhi. I'm the viral hepatitis and STD epidemiology team lead here with the Georgia Department of Public Health. I've been in this role for about 5 years, but prior to that, I was the viral hepatitis prevention coordinator for a little over 8 years. So I'm going to talk a little bit about our viral hepatitis program, as well as some information about the Georgia immunization program and how we've collaborated over the years. So I did want to talk a little bit just about our program and how we're organized. Organizationally, our program sits under the Office of Epidemiology, and more specifically under the Acute Disease Epidemiology section. We are an integrated team, so our program includes surveillance and epi for hepatitis A, B, and C, as well as our prevention coordinator program, and perinatal hepatitis B prevention also sits under our umbrella, as well as perinatal hepatitis C. And I wanted to mention that because I think because our program does include hepatitis A and B epi, as well as our perinatal hepatitis B program, it does help kind of bridge that connection to our immunization program. And it makes it definitely a lot easier, as Heather alluded to, just knowing the people in that program. A little bit about the Georgia immunization program. Organizationally, it's housed in a different division under clinical and medical services. And as we all know, it supports our perinatal hepatitis B prevention program. They manage the vaccines that are funded through the Federal Vaccines for Children program, as well as federal Section 317 immunization grant that Heather had mentioned as well as our Peach Care for Kids program. Here in Georgia, 317 vaccines are available at all of the Department of Public Health department clinics statewide at no cost to those that are uninsured or underinsured. There is an administration fee for patients receiving 317 vaccines at the health departments that has a cap of $21. However, if someone does not have the money to pay that administration fee, they should not be refused vaccination under Section 317. However, if the patients are insured, our health departments can bill the insurance for that cost as well. I won't go through all of this. It just kind of show who here we've designated as being eligible for the federally funded 317 hepatitis A vaccinations. And again, these are available for anyone who is uninsured or underinsured. And as you can see, it's all through the high risk populations that we would be concerned about. So men who have sex with men, those that are using drugs, female partners of MSM, anyone engaging in sexual practices that could facilitate transmission of hepatitis A. Also, anyone with chronic liver disease, including Hep C, are also eligible for 317 vaccines for Hep A, adult Hep A vaccines. Those with HIV, homeless adults, and really, essentially anyone who requests vaccination can get it if they are uninsured or underinsured. And the same thing for hepatitis B. We have adult hepatitis B vaccines available in all of our health departments as well. We have both the 2-dose and 3-dose series available for all adults 19 years of age and older. And again, it's all of our high-risk populations that would be eligible for the adult Hep B vaccination. So men who have sex with men, those using drugs, anyone seeking STD or HIV services, regardless of any risk behaviors. If they're seeking those services through our health departments, they can be eligible for the adult Hep B vaccinations. Anyone with multiple sexual partners or a recent diagnosis of an STI, homeless adults, our family planning clinics also have access to adult vaccinations. Sexual partners, those on hemodialysis, diabetics, and again, really anyone who requests vaccination, if they're uninsured or underinsured, they would be eligible for adult Hep B vaccinations through our 317 program. So there's a lot of information on this slide, so I'll go through it. But here in Georgia, we do have an adult vaccine provider program, which allows for 317 vaccines to be used not only at all of our county health departments, as I mentioned, but also for non-public health providers can also enroll as an adult vaccine provider and have access to 317 funded vaccines. Currently here in Georgia, we have 81 non-public health providers that are enrolled as adult vaccine providers through our Georgia immunization program. These providers should be serving clients that are uninsured or underinsured. And prior to enrolling into the program, they have to have the infrastructure already in place prior to being approved. And that includes things like making sure that they have the appropriate storage capacity, including the appropriate data logger thermometers. They have to complete and sign an adult vaccine provider agreement with our immunization program. They can expect routine site visits from our immunization program field staff. And then there are requirements to report on a monthly basis their vaccine inventory that they have on hand, as well as all the doses that were administered to uninsured or uninsured adults through our immunization registry. So through this program, they can request adult Hep A and Hep B vaccines, as well as other adult recommended vaccines that I have listed here. So Tdap, meningococcal, influenza, MMR, pneumococcal, varicella, HPV, shingles, as well as the COVID vaccine. And Mpox is italicized because we're hearing that it's going to be available commercially soon. And once that happens, 317 funds here will be used to also provide the Mpox vaccine. So just some collaborations and how we've been able to collaborate between our program and the immunization program. As I mentioned earlier, because hepatitis A and B, as well as our perinatal hepatitis B program, fall within our umbrella, that's helped bridge a lot of that connection to the immunization program. But some things that I've learned over the years is really, as Heather also kind of alluded to, knowing who your key staff are in the immunization program. So it's not, necessarily enough to just know who the director is or who one person is, but knowing who is over the adult vaccine program. I know here we have one person that's over the adult vaccine program. There's another person that's over our immunization registry. There's another person that does all of the special projects and education. So knowing who those key staff are, so that way if there is an opportunity to collaborate, or you want to run ideas through someone who to contact. Participation in immunization meetings and conferences. A lot of this seems kind of common sense, but it's something that I've had to learn, that just being present in some of these meetings and conferences, even if I can tell you I've done plenty presentations where I would look out and see blank faces out in the audience. But trust me, they're hearing the information. Well, they may not seem like it, but they are getting the information and they know who you are. And so when those opportunities arise, they know who to contact with the viral hepatitis program. We have specific hepatitis trainings that we recommend for immunization nursing staff in our health department. So we've worked with our immunization program to offer these trainings, and our immunization program provides CEs for nurses in our health departments that participate in these trainings. We've partnered for various vaccine education efforts, so vaccine clinics, if there's opportunities, if there were, over the last couple of years, if there were any Mpox clinics going on, trying to integrate either being able to provide hepatitis A and B vaccinations, or at minimum, being able to provide education during those clinics. We run, articles in their newsletter occasionally, and then when there's opportunity for any provider education, we'll partner with our immunization program for that as well. And then, again, seems like it would be common sense, but looking for any opportunities in the immunization grant or, supplemental projects to try to integrate any adult vaccination efforts. Even if it's, an example would be just recently, there were, carryover funds available, and we proposed a project to possibly do hepatitis B vaccinations in our jail population. So just looking for those opportunities, again, being present in those meetings, and just hearing what's happening can give you an opportunity to find those opportunities. We also fairly routinely will do data requests to monitor adult Hep A and B vaccinations. And we can get that from our immunization registry, and we can stratify that by clinic type as well as provider type. So if it's a public health provider versus a private provider that we're administering the vaccines. If it's through the health department, there are ways to tell if it was done in an STD clinic, an HIV clinic, that sort of thing. We have immunization staff that are involved with our viral hepatitis elimination work group as well, and we have specific vaccination outreach activities that are integrated within our plan as well. And then one key thing that, Heather also kind of spoke about it a bit was, connecting those community partners that we all work with to those key immunization staff for education, or possibly even getting them enrolled in the adult vaccine program. One example that I'll talk about in a moment, we were able to assist one of our local SSPs to become an adult vaccine provider here in Georgia. And then also for any outbreak response, I know a number of us went through a Hep A outbreak over the last few years, making sure that they're included in that response effort as well. And if you have, outbreak plans that you're developing for hepatitis B, making sure the immunization staff are included in those strategies as well. So on that note, Georgia was one of the many states that experienced a hepatitis A outbreak these past few years. Our immunization staff were included in our hepatitis A incident command structure and were involved in the response to our outbreak. And their role in this too also included providing waivers to our public health districts that had declared outbreaks. And what this did was allow them to bypass that insurance screening and allowed them to more easily use 317 funded vaccines to do outreach. So they were able to more easily go into the jails or homeless shelters and things like that without having to worry about screening folks for insurance in order to use the 317 vaccines. And during our response, we also monitored our immunization registry for vaccine administration statewide. And then our public health districts were also required to report vaccine outreach data to us on a weekly basis, which was included in our weekly situational reports. And as I mentioned earlier too, we work with one of our local SSPs here in Georgia and connected them to the staff in our immunization program so they could become enrolled as an adult vaccine provider and have access to those 317 funded vaccines. And we were able to get them enrolled during kind of the peak of our hepatitis A outbreak, which our outbreak here was primarily driven by individuals that were using drugs. So it was really integral to make sure that we had our SSPs involved in some of that response. So we were able to enroll them as an adult vaccine provider during that time. And once the pandemic hit, all of our vaccine outreach that we had been doing in response to our outbreak essentially stopped. So having SSPs being able to continue providing vaccines was very helpful during that time period. Currently, this SSB, Georgia Harm Reduction Coalition, is the one we work closely with. They have locations in over 30. They have over 30 locations across the state. And even outside of our Hep A outbreak, they continue to provide adult vaccinations to their clients. So not just Hep A and B, they also have Twinrix, COVID, influenza, Tdap, another typo, that should be HPV, Nuvovax, as well as the Mpox vaccine as well. And just a quick plug, they're actually doing an event, a vaccine event this week that I just recently found out. Okay, and I'm happy to take any questions.
All right, thank y'all so much for the presentations today. I don't know, these are really great information, and I'm glad that y'all are able to share what y'all have been able to do. Even if it's small things, but it really makes a difference, and it's really important. And I like how both of you all stress ensuring that y'all have connections with vaccine programs, with folks in the community to increase access for folks. And let me get us all on the screen. So there we go. All right, so if anyone had any questions, I know Heather, you went through some of the ones that have already gone through the chat. But folks, if you would like to come off mute or write in the chat, any questions or anything? All right, I have a question from Donna for Amy. It seems as if you have a liberal eligibility for vaccines in Georgia, anyone that wants to be protected against Hep A, B. So if there is someone who actually has insurance, can you still vaccinate with that clause in your eligibility statement?
Sorry, can you repeat that? Let me read that question again, make sure I got it.
It says if you have, it seems that y'all have a liberal eligibility criteria, so pretty much anyone that wants it can get it. So if folks want to get vaccinated and they have insurance, can you still vaccinate them?
Yeah,
And I guess for free.
Yeah, so well, if they are insured, they would not be eligible for the 317 adult vaccines, but our health departments do have the ability to bill insurance. So if their insurance is covered, will cover the vaccine, then they can still get the vaccine in our health departments. If their insurance doesn't cover vaccines, then they would be considered to be underinsured, and they would be eligible for the 317 vaccine.
Yeah, I think most insurances cover Hep A and B without cost sharing for the client. So if insurance is billed, they wouldn't have to pay. Anyone else have any questions? All right. So we have a question from Alan. It says, in our state, immunizations reporting is required if the patient is under 21, but optional for patients age 22 or older. So it's difficult to estimate adult vaccine coverage from the registry. Do others have this issue? And if so, have you been able to find other acceptable data source to estimate vaccine coverage?
I'm happy to chime in if but others please chime in as well. So that is one major difficulty here. I will say after COVID, pre-COVID, it was very difficult to find the true sort of estimate of how many adults are vaccinated using our immunization registry. I will say post-COVID, that became a lot better because now providers are a little bit more used to having to put that information into our immunization registry. So they're putting in other vaccinations as well. But that's been a huge challenge. And I would love to hear from other folks if they found other data sources to to get a better estimate of that. That's something that we definitely struggle with.
Yeah, I saw Rachel from San Francisco had their hand up. I don't know if you had a question comment regarding that question.
No, it was separate. So I can wait if there's more discussion on that topic.
Okay. Yeah, and Kyle from Florida says adult vaccinations are entered at the discretion of the provider. In Florida, it is difficult to estimate. Anyone else had any thoughts or comments about estimating vaccine coverage among adults? Okay, well, if y'all have thoughts or comments or anything to share later, feel free to let us know. Danica? And also feel free to let Alan know as well.
I was just going to chime in and say, you know, that we have adult vaccinations are required to be reported in Philadelphia. However, that didn't happen until, I don't even want to give the date because I'm not in immunizations, but not until, you know, within the past 10 years. And so while it's really great that new vaccines are going in, we don't have vaccine history for a lot of folks. And so, Alan, you know, we're right there with you. It's really difficult to estimate, you know, vaccination coverage for adults, even with new reporting, because many, especially with B, you know, people got it when they were younger. And so they might not have even been in your jurisdiction then, but it's a barrier, I think, definitely for us too. I'm sure other places.
Well, and so many people don't even know themselves if they've been vaccinated, or if they completed the series, or if they completed it in time, or if they're, you know, if they did it as a child, did they complete it? If they did it as an adult, they may not remember. So even just asking them is often very challenging. So yeah, you might get the triple screen, right?
Yeah, it seems like that'll be an ongoing challenge, I imagine. But I guess some folks maybe have had some more positive experiences with getting estimates or getting providers to provide that information due to COVID changes and COVID vaccine stuff. But I guess if we don't have any other thoughts, Rachel, if you wanted to pose your question.
I think I actually was remembering wrong, and it's actually about Hep B screening, I believe. But I'd heard that some people were having trouble with billing Medicare for, I had been thinking it was the Hep B vaccine, but I think it was actually the Hep B screening without having high risk, because that it's not, the other guidelines haven't been updated yet. So I was wondering if anyone like had any experience with that, and if they had figured out any workarounds for it, but it's a bit more off topic.
I don't know, but if folks don't have any thoughts on the call, we can definitely follow up about that. Yeah, we have a comment from Philip. If folks haven't been vaccinated, may have been vaccinated, but they don't have any record, they may not know what to look for in their labs. Also true. All right. I guess wanting to hear, I guess hearing from Heather and hearing from Amy about how you all have worked with the immunization program, especially on some of the things surrounding not just being able to provide the vaccine, but building that infrastructure. And I like, Amy, how you said about providing education to the immunization nurses. So that way, I guess it will increase their awareness of hepatitis B and why this is important and why it should be a question when they're screening folks. So I'd like to hear, I guess, other thoughts and stuff from you all or folks from the group about like how you all have been able to work with your immunizations program, maybe not specifically on being able to provide vaccines, but building up that infrastructure. And making sure that if we figure out how to pay for these, how can we support vaccination and ensuring that folks are be able to be administered. And also, I guess, a little bit to Rachel's earlier question about ensuring that folks get their subsequent doses as well. So I don't know if anyone had any
Yeah.
thoughts about
I
that.
just wanted to make one quick comment. I think Amy will
Mhm.
have more to say on this, but one thing that was really helpful for us is we have a coalition at the health department level of all people who work in some sort of program that works with people who use substances. So
Mhm.
in that group, we have people from tobacco, people from medical marijuana, we have our alcohol program, we have our opioid overdose program, we have our harm reduction programs, we have HIV, STD, hepatitis, right? We have all these programs together, and we meet every other month, every quarter, and we just kind of talk about common issues that we have. So it was because of that and how we'd invited our immunization program to join that group. Otherwise, I wouldn't know anybody in our immunization program, let alone the exact Hep B people to go to when we had our prep clinic question that I talked about earlier. So, and I just wanted to reflect back on what Amy said. It's about sometimes getting them in the room with you or you getting in the room with them. And sometimes we think, oh gosh, I just can't do another meeting. But sometimes it is just important to be like, hey, do you guys have a quarterly meeting where you meet with all the local health departments or something like that? Can I join that? Can I listen? Can I talk about some of the things we have? And because I think you may be really, really surprised that there are maybe resources and ideas or questions that you can help each other out on just by literally knowing what each other are doing. So I really do encourage that, and I'll pass it back to Amy.
Yeah, I mean, I think you said it all there, actually. I mean, I just reiterate, I can't tell you the number of times I presented or talked during an immunization meeting and was just faced with a bunch of blank stares, like completely wasted my time, but they know who I am. So when those questions come up or there's an issue in their local districts, they know who to reach out to when they have questions or need some guidance. So just knowing who the face is that you need to be talking to is, I think, number one thing to try to do.
Yeah, thank you so much for that. And I was also thinking, it'll be a good thing also to work with other health programs like health promotion and other things, because they do a lot of work with the community, with providers and just providing, increased information and increased awareness among all these programs to ensure that folks who have access to immunizations access to insurance are able to be immunized as well. So I see we are close on time. Community health workers, yes. But I don't know if anyone else had any last minute questions.
Yeah, I do see a question in the chat too about using the Hep B Foundation mini grants to support Hep A and B vaccines. I don't have any experience with that particularly, but I don't know if you know more or anyone else has any of their Hep B Foundation partners used those mini grants for vaccines.
Yeah, I'll follow up with Venetia, but if anyone on the line has any experience with the B mini grants. All right. Well, I want to thank you all again so much for this great presentation. It's for a topic that's kind of elusive for some of us because, like, where do we find the funds? But there's many different opportunities to work with our immunization programs, with our community partners to increase access. So thank you all so much for sharing this information. Thank you all for being here. And please follow up with us if you all have some programs or some models that you would like to share with the wider group about how you all have been able to reach folks, especially folks with limited access to healthcare settings or insurance. So that'll be awesome. We can learn a little bit more and share with you all wider through this resource. So yeah, thanks again. And you all have a great rest of your week. Thank you.